Welcome everybody to this series on holistic health. So what is holistic health? It is not a mere absence of disease, but the presence of physical, psychological and spiritual well-being. The psychological component has three constituents: emotional health, social health and mental health. I will be covering all these three topics one by one. In psychological ill health, to understand them better, we can categorize them into three groups: disturbances, disorders, and diseases. So, what are disturbances? Those are our emotional reactions to adverse life situation and events. Like, say, having to stand in the queues or traffic jams, power failure, water shortage, overcrowding, overload of work. These are the stresses we face day in and day out, and that disturbs us. These disturbances come, stay for some time and go away. Again, another situation arises, we get upset, again it lasts for some time and goes away. So it comes and goes, it is transitory. It therefore doesn't cause much problem in our day-to-day activities, in our day-to-day functioning. And we can pull on in spite of these disturbances. And that is the reason why we ignore them. Also, these disturbances are so common that we mistakenly believe them to be normal. They don't cause much incapacitation in our life, and therefore we ignore them. And once we ignore them, it leads to disorders. In disorder, what happens? Before one disturbance goes, another arises. Before the second goes, a third arises. Before third goes, the fourth arises. So the person is more or less continuously disturbed. Here, the incapacitation will be little more. It leads to three types of disorders: personality disorders, neurotic disorders, and psychosomatic disorders. What is personality disorder? In this, the person's nature is such that it interferes with his effective functioning. And because of the lack of control over that nature, it leads to interpersonal conflicts. And there are varieties of personality disorders. In neurotic disorders, it affects our sleep, our appetite. It interferes mildly with our day-to-day activities. But we can still pull on. All investigations turn out to be normal.
So, what is actually psychosomatic? How can it be represented?
Psychosomatic means they are diseases of the body, but their origin is in the mind. Like high blood pressure, diabetes, peptic ulcer, bronchial asthma, irritable bowel syndrome, migraine, and whatnot. In fact, 60 to 80% of the illnesses have their origin here. One of our teachers in a medical conference made this statement: 60 to 80% of the illnesses have their origin here. A physician got up after him to speak and he said, "I don't agree with Dr. So and so." So the organizers were afraid that there will be a quarrel between these two. He said, "It's not 60 to 80%, it is 90%. So most of the so-called physical ailments also have their origin in the emotional disturbances, which we fail to recognize. Now both disturbance and disorders can be treated with psychotherapy. Usually what happens, when we are upset, we blame the situation and try to correct it. In psychotherapy, there is no attempt to correct the situation, but there is an attempt to change your attitude toward that situation so that you are able to take it in your stride without getting upset. Examples of various types of disturbances: anxiety, sadness, irritation, anger, hurt, envy, and whatnot. Now, the psychotherapy will work only in disturbance and disorders, but not in the third group, the disease. This is because the cause of the diseases is not outside in the environment, but it is within ourselves. And what is that cause? That cause is biochemical neurotransmitter imbalance at the junction of the nerves. And this leads to major mental diseases like major depression, bipolar mood disorder, obsessive compulsive disorder, or schizophrenia. In this group, the incapacitation is severe. You cannot function to your normal ability because of these diseases. And here, the treatment is not psychotherapy, but medication. These drugs correct the biochemical neurotransmitter imbalance of the nerves and relieve you of the symptoms. If you want to know the interrelationship between these three groups, say we have a mind and we have a body. When there is a physical cause, there is a physical effect. Like if a person is injured, he'll sustain a fracture. If there is infection, there's going to be fever. Similarly, when there's a mental cause, there's a mental effect. If somebody fails in exam, he's sad. If somebody abuses you, you get angry. But there's a cross connection between the two. Many a time, there's a mental cause with physical effect. These are the disorders, the psychosomatic disorders. And many a time, there's a physical cause with a mental effect. What is that physical cause? As I mentioned earlier, at the junction of the nerves in that synaptic cleft, there are some chemicals and there is an alteration in their levels. So the message from one nerve to the other is not proper. And that leads to these psychotic diseases. Now, when the symptoms are mental, the person doesn't know whether it has come from here, it is a psychosocial issue, or whether it has come from here, that is a psychobiological issue. That is the role of the psychiatrist. So the psychiatrist is a specialist who deals with these mental illnesses only. He is a medical graduate who has done a post-graduation in psychological medicine, and legally he is the only one entitled to prescribe the medicines for the correction of these psychotic diseases. Who is a psychologist? The psychologist is like a pathologist is to a physician. The physician orders some investigations, the pathologist carries out those investigations and sends the report back to the physician. Similarly, the psychiatrist may order some psychological test, which the clinical psychologist will carry out and send the reports to the psychiatrist, who can use those reports in determining which type of illness the person has got. Who is a psychotherapist? The psychotherapist is the one who treats these disturbances and disorders with the help of psychotherapy. A psychiatrist can become a psychotherapist, a psychologist can become a psychotherapist, a social worker can become a psychotherapist. Any person who is interested in helping people with their emotional ill health can become a psychotherapist. So, in this series, we are going to take up these various types of ill health one by one. Yes?
What is the difference between counselor and psychotherapist?
Very good question. For that, I'll give you the entire range. Most of the time, when we have some problem, we seek somebody's advice. Now, usually the advice that is given to us applies more to the giver than the receiver. So we will advise the other person to do exactly that what we would do were we in their place. But everybody's natures, capacity are different. So the advice may not necessarily apply to the receiver. Then there is a guide. Like say, suppose I want to go from Mumbai to Ahmedabad. Then I want to know what are the various means by which I can go. So I approach a guide and he tells me, you can go by train, you can go by air, you can go by car. So he gives me the various options available to me, so he guides me. Then who is a counselor? Now the counselor does not only guide you, but helps you in the selection of the means which is best suited to your requirements and to your resources. So he will discuss with you. You are in a great hurry and money is no problem, go by air. You can go leisurely, but money is the constraint, then go by train. You want more comfort, go by car. So he helps you in the selection of the various means that are available to you. Then comes the tutor. He will not only help you in the selection, but he will also help you in the execution and follow up every step. He will ask you, did you book your tickets? Did you arrange your luggage? Did you take the necessary materials you'll require on the way? So step by step is guiding. Then comes the mentor. So the mentor also follows up in your step by step execution, but not so closely as a tutor. And then comes the psychotherapist. He will ask you, why do you want to go? So till mentor, the agenda is set by the receiver. The guide, the counselor, the tutor, the mentor helps the person in the execution only. Whereas the psychotherapist helps to revise your agenda, why you want to do it. So there is a complete change in your orientation to life through psychotherapy. Of course, this term is not very prevalent and most people choose to call it counseling. So different professionals have different roles. In fact, there is a subgroup in psychotherapist, the psychoanalyst. Now that's a special type of psychotherapy, which of course did not take much roots in India. There are a few pockets in Mumbai and Kolkata, but it helps you to change your very nature. It is more lengthy, more frequent, and of course more costly than the psychotherapy. However, experience has shown that it has not been able to deliver the promise it gave. So the one-time preeminence that it enjoyed, our teacher told us that when he was a student, the promotion of the person depended upon whether he is a psychoanalyst or not. And because those psychoanalysis sessions were very costly, because the psychoanalysis couldn't take more than few people at a time, the frequency of those sessions used to be 1 or 2 hours every day for 5 or 6 days a week for years together. So they could take only few and he had to make his bread and butter from that. So the charges were very high. So the student psychoanalyst had to pay. And because they were costly, they used to skip a meal a day to be able to afford the psychoanalysis sessions so that their promotion is ensured. In one issue of Time magazine, which was dedicated to mental health, there was an article in it where Freud was shown to be sitting in tattered clothes in the unemployment bureau. So from that eminence, it has come down to this level.
Suppose people don't agree that they have a psychological problem.
True.
So how to get them ready to go to a counselor or seek for a therapy?
True. The psychological diseases, the mental diseases that I talked about, one particular illness, namely schizophrenia, is characterized by lack of insight. That the person himself or herself does not even realize that they have the illness. And therefore, they will be very reluctant. They don't see the need at all to approach the psychiatrist. So they don't come, they are brought to the psychiatrist, they don't come on their own. In fact, many a times what happens is the patient may not come at all.
So how does one recognize emotional disturbances?
Like what we undergo. Anxiety, hurt, irritation, anger, sadness, envy, that all we experience in life. But because it is so common, we mistakenly believe it is normal. It's a minor abnormality, but it is the yellow signal alerting us to rectify ourselves. But instead of rectifying, we justify ourselves. We say, if somebody abuses me, shouldn't I get angry? Or if my child doesn't study well, shouldn't I be worried? Or if some fails in exam, shouldn't he be sad? We justify it. We consider it is perfectly okay.
So how do we rectify it?
That is the entire series. We will be coming, after the theory though, we will come to the practical sessions where the technique of rectification will be shown.
Sir, but what you're talking about, anxiety, sadness, anger, these are normal emotions what
Yes.
everyone experiences.
Yeah.
And we say these emotions makes the life colorful. If emotions would not have been there, then life would become very dull and boring.
True?
So
At
and
what
you're saying
cost?
it is a disturbance. So how is it like?
True. So we are making the life delightful at what cost? We don't even know the price we are paying for this. In fact, because we are interested in these emotional situations, we seek them out. We induce these emotions to enjoy life. Sure, we do enjoy, but are we even aware the price we are paying for it? Like say, when we buy some clothes, we also look at the price tag. No? If the cost is much more than what we feel is worth, we don't buy it, though we have liked it. Similarly here, are we aware of the price tag?
What is the cost, sir?
What is the cost? The cost is your efficiency goes down. The cost is your relationships are hard. The cost is that you suffer from psychosomatic diseases or neurotic disorders. But we do not connect the two. We consider them to be independent entities. Actually, they have a cause-effect relationship, which we are not aware of.
So sometimes emotions are a social requirement. Even though you don't feel much of it, you have to show, the society expects you to behave in a way, because then you have to demonstrate that you have those emotions. And therefore you suffer, whatever happens, you have to. So how to, how to educate people that, emotions are not required.
First,
Unnecessary.
educate ourselves.
Yeah.
Because you cannot educate a person who refuses to get educated. You cannot push it down somebody else's throat. So, if the other person is seeking your help, how can you remain so calm in such a stressful situation? Yes, you can share your experience. How you achieved it is what you can share. But unless the other person is interested in it,
Not to.
not to.
Not to touch that, yeah.